Good afternoon, everybody, and welcome to the Back to School webinar hosted by the Center for Developmental Psychiatry. We're really glad that you could join us today. And as families gear up for a new school year, we know that it could bring a lot of excitement, but also stress and challenges for kids, teens, and parents alike. So today's session is really designed to provide practical strategies, resources, and support for navigating this transition. So before we begin, just a couple of quick notes. This session is going to be about 45 minutes, and it is a question and answer session. So please feel free to drop any questions in the chat as we go along. And we are recording the session, so we'll be able to share this as a resource to you afterwards. So my name is Natalia, and I'm going to be the moderator for today's discussion. And I am excited to introduce you to our speakers, Dr. Jason Dean and Dr. Divya Patel. Dr. Dean is a child and adolescent specialist, psychiatrist, and he specializes in helping children and teens with anxiety, ADHD, mood challenges, and school-related stressors. And Dr. Patel is also a child and adolescent psychiatrist. She's got extensive experience working with families on academic, social, and emotional challenges. So with that, together, Dr. Dean and Dr. Patel will share some insights on easing into school-related anxiety, balancing academics and emotional health, as well as navigating supports like IEPs and 504 plans. So with that being said, I'll turn it over to Dr. Dean just to get us started.
Thank you. Thank you for that wonderful introduction. So the goal for today is really to address a lot of different issues that contribute to a lot of stress for a lot of parents. I think the summer is usually a pretty relaxed, chill time, and then the transition back into school can be really difficult for a lot of families who have children who, let's say, have ADHD, learning disabilities, different kinds of challenges that happen specifically in school, which I think we find with a lot of our patients leads to a lot of conflict between parents and children with, doing homework in the afternoon and things like that, or even school refusal where children don't want to go to school. There's a lot of, fighting and anxiety around that. So our goal in doing this webinar was really to address these issues, mostly in a question and answer format. So we have some questions that already came in before the webinar that we can go through. So anybody attending who has any questions can just, drop questions as we're talking into the question and answer at the bottom in the chat, and then we'll address it. I don't know if Dr. Patel, you want to say anything about your perspective on some of this?
Yeah, no, thank you. I agree. I think that this hopefully is really beneficial for a lot of parents, also themselves kind of feeling this anticipatory anxiety around getting back into a routine. I think it can be stressful for the entire family system sometimes to just, get everything in place so that way they are organized and they are also able to kind of be there for their kids in a good way. And so I'm happy to be here and answer questions and really just provide whatever insight I can in making that seamless and smooth for everyone. And then what you can do if it's not going seamlessly, right? It's okay to have some bumps in the road, but it's good to kind of be proactive and know what you should and shouldn't do in those situations. So that way things can at least progress more positively for your kiddo.
Okay, wonderful. So let's go ahead and get started. I've got a lot of great questions here. So let me just pull these up. Okay. All right, so we've got the first question here. My child hears many instructions and corrective feedback each day. Examples are, please stop, don't do that, and we worry that this could affect his confidence. While we try to explain our reasons and reassure him of our love, it remains challenging. At the same time, we don't want to ignore repeated behaviors. Any guidance on helping a child with ADHD build healthy self-esteem would be very helpful.
I like that question. I think it's an important question for everyone to think about. I always talk about the developmental kind of impact on kids with ADHD as they navigate systems, whether that's school, whether that's activities, or even being in a home, let's say with siblings who don't have similar challenges, or parents who don't understand the challenges in a way that hinders kind of their self-esteem. And I think this question is trying to ask, if I'm understanding correctly, is how to parent a kiddo with ADHD in a way that helps them build their confidence and build their self-esteem and not feel very sensitive to their challenges and vulnerabilities. So I think it's like a very difficult task, and it's hard because a kid doesn't exist in a bubble. And so you really have to collaborate with everyone that's involved, including their teachers, including the school, as well as any other parenting figures, right, that might be helping you with the kid. I would say overall perspective that has helped me the most in working with kids with ADHD is helping themselves understand their challenges a little bit better and helping them come up with situations or, solutions to certain challenges they may have. They're coming up with it themselves. And so one, it enables them to figure out solutions to certain challenges they have. And it also is something that's easier to implement because they're thinking of it and they can help you implement certain strategies. For example, if they have trouble remembering their assignments, I recently had a child who we were thinking about it together. And we're like, all right, this is a challenge, right? You're having a lot of trouble remembering what assignments you have to complete. And, this kiddo was very tech savvy. And he was like, here, I can set up this like calendar where I can just write all these things that, I need to complete, and it'll like flash when it's due or whatever it is. And he came up with that system on his own, and it's been working pretty well because he knows himself now at this point in treatment enough to know what's going to work and what's not going to work for him. So I think the first step is just helping your child like understand themselves a little bit better and understand their challenges better, and then parents doing the work to like understand their kids' challenges a little bit better and what systems may work and what may not work, because you'll see a lot of advice out there that's not really personalized, and then it becomes very challenging or disappointing when you see that schedule should work but it's not working for your child or your family. So I think really just trying your best to speak with someone that understands you, your child, your family. It takes time to do that so that they can give you positive feedback around what to do and how to talk to your kid about their challenges. I don't know, does that answer the question, Dr. Dean?
Yeah, one thing that I really agree with that you're saying is this idea of a child taking their own kind of initiative, because I think one of the things that really happens in these situations is a power struggle that kind of develops. And so, I think part of the question was there's a lot of corrective things, being said. And so I think when you encourage a child to kind of take their own initiative, then a little bit of that power dynamic is reduced. I think one important thing that I would point out from this question is I very often see that ADHD is kind of like a kernel around which other diagnoses and other issues build. It's almost like a snowball rolling downhill, So if you like this story kind of plays out over many years, but in the beginning, usually you have a kid who feels pretty good about themselves who has ADHD. And then, the first time a parent tells them to do something, they didn't hear it. The second time they got distracted and they forgot. And the third time, they couldn't figure it out. And then the fourth time, the parent's screaming at them, right? And the kid, they don't realize it's been 4 times, and they don't realize that the adult's getting frustrated. All they heard was that fourth time was that child's first time. And so, it's constantly happening at school, constantly happening at home. And children are what we call egocentric, which it doesn't mean, egocentric sounds like really bad, but what it means in this context is they just think everything is due to themselves. So, until the age of like really 12 or maybe even older, a child has no ability to say like, oh yeah, like I understand like other perspectives. I understand why this is happening. I have ADHD. They just interpret it as that like I'm a bad kid. There's something wrong with me. And unfortunately, children can kind of really internalize this sense of being deficient, having something really wrong with them. And then that secondarily will often lead to behavioral issues because a child is angry about this, right? It's like they're angry that everybody's always, mean to them or bad to them or all these different things. Because when faced with a choice between 2 different narratives, one narrative is I have a problem and I can't do something. The other narrative is you all suck, you're all mean to me and you're putting unreasonable demands on me. A lot of kids will go with that second one, right? And so then they develop kind of like this worldview, this like angry kind of bitter worldview, which down the road can be problematic. So I think the main thing is to get treatment. I don't know if the person in the question mentioned if the child is getting treatment, but I think a lot of people are wondering like when is it important to treat things in general or ADHD in particular. That this is one example when you start to notice that your child is developing some self-esteem issues or these underlying negative feelings about themselves. I see that as a really big red flag. So I don't know if that answers the question exactly, because I'm kind of just exacerbating or I'm kind of emphasizing the problem. answering. But I think the answer is really to get treatment. And then, as Dr. Patel was saying, to help them develop their independence and kind of find ways to feel good about themselves.
Yeah, great answer. That really helped explain, what's going on in these situations. And there actually is a follow-up question to that. Do you
Oh.
think that an 8-year-old is a good age, or is it still too young to discuss with your child about their ADHD diagnosis?
I guess I'll start. I think that that's a tough one because kids are kids are really smart and kids are very like in tune to what's going on and what's happening. And so it depends, right? If this is an 8-year-old coming to see me, the first question they're asking their parents or me is like, why am I coming to see you? Why, like my brother is not, or my friend is not. And so you're already kind of developing this like mindset that Dr. Dean was talking about of like, I'm different in some way. And so I think the fear might be around like, okay, if we discuss this ADHD diagnosis with an 8-year-old, is it too young? Will they internalize it in a negative way? I actually feel like in generally most things, like communication around it matters a lot. And so I think that having a doctor and having like, a therapist and like really trying to paint this challenge, right, like ADHD as something that is there, right, like, and maybe not saying that this is ADHD, but just helping the child understand in terms and in ways that they are developmentally able to understand, right? And so you can work with us like one-on-one personally to kind of figure that out. But I would say the answer is that hiding it is really not going to work because they are already developing some notion of something is wrong and like they are struggling more than other kids with certain things. So I do think like talking about it to discuss it with them is likely a good idea, but it matters how you do it. So I would say I would err on the side of getting some guidance from whoever is treating them to figure out what's the best way with this child, because it really just depends on the personality of the child, where they are developmentally, of what they can understand, and how to phrase things in a way that will have a positive impact on their development, as opposed to create additional stress about the diagnosis.
Yeah, I agree. I think the challenge is to balance being honest, but also not to feel like you're labeling somebody or make the child feel like they're labeled. I think that diagnoses are tricky. Like people have very different responses. I've had patients who, when I gave them a diagnosis, started crying that they were so happy because they finally had a label for what they were struggling with. And that there are some children who they think they're the only person who has that challenge. And to hear, you have this diagnosis, it's a real thing, it's a medical entity, many people have it, you probably have kids that in your school that have it, that can actually bring a lot of relief for some people. On the other hand, some people might feel like incredibly limited by a label or a diagnosis and think like, okay, I have ADHD, I'm never going to be able to do X, Y, Z or whatever. Like a lot of things, it really does depend. So I agree, Dr. Patel, with your idea of kind of coordinating with whoever's treating the child. But, I think the other thing is, it's funny when we're answering these questions, we can't really talk to the person directly to have like a follow-up a little bit, but I'm kind of like sensing in the question that there's maybe some anxiety or concern on the parents' part about talking about this with their child, about like what it's going to do. But the truth is, like, if you think about it, it actually adds a little bit of stigma sometimes if we feel like we can't talk about it, because it doesn't have to be a big deal. Dr. Patel, I think you use this analogy a lot about glasses. It's like some people just need glasses. So you don't have to feel bad if you need glasses, right? And so some people have ADHD and they have trouble focusing, but it's a neurologic, neurodevelopmental thing that has nothing to do with the person's character, let's say, or their worth as a person. And so I think my policy is usually to be honest and just say, you have this problem, but it's not a big deal. And I think also children are looking to their parents for a sense of security that it's going to be okay. So I think the follow-up should, be, and here's what we're doing to help you, not just you have this thing and then like bye and you walk away and like leave them with that. You have this thing, a lot of people have it, and I'm going to have you, meet with so-and-so who's going to help you with this. And then they're like, okay, like my parents kind of like have my back, like, and I think that's the best approach generally, but not to, I think as parents, we often, how do I say this? We let our own anxiety cause us to like over elaborate to our children, because, for instance, like I think it was 8 years old. Was that the question? So at the age of 8, right, developmental stage is also important. Like a 15-year-old could maybe understand on a much higher level, but an 8-year-old, it could just be something as simple as like, you have this thing, it's called ADHD. It just means you have trouble focusing, but there's help for that. You could take a medication for that, let's say, or whatever it is, without making it into like such a big deal. I think that we can be honest about it without making it into like a really big deal.
Great answers. They did have an additional question on top here. I often struggle to determine whether some of my child's challenging behaviors are part of his personality or if it's a result of ADHD. It can be difficult to pinpoint the cause, especially since he's already on medication and its effectiveness can vary throughout the day. As a family, we try to be consistent with expectations and rules, but sometimes it's hard to know when he genuinely cannot meet them due to ADHD. I'd like to better understand how ADHD medication and my son's personality interact and influence his behavior.
That's a great question.
Yeah.
I think that is a question that everyone should be sort of asking at whatever point in treatment their child is in, right? Because kids grow at a very quick rate. Their personalities develop like a lot from the ages, let's say from 10 to 15 to 20. And obviously ADHD is a component of their development, but it's not, their a whole personality or the root cause likely of all of their challenges, as it's not true for anyone else, right? Like there are children with challenges, there are adults with challenges who don't have ADHD. So I think like understanding, how ADHD is manifesting in your child, right? So really understanding what ADHD is and how it can lead to certain challenges and like how that might be happening, for example, with your child at home. That might help you better understand, like if you have a better, deeper understanding of what ADHD is and what kind of challenges it can actually lead to. And then I think an additional kind of follow-up to that is, how much of that is fixed or helped by medication, and how much of that, even if it is stemming from ADHD, requires more behavioral work, more understanding your personality features, and like building your life in a way that builds to your strengths and not your challenges. So I think it's like a very complex situation where it's not always going to be that, medicine will address all of the challenges that ADHD is, like creating or stemming from. But I do think that understanding it better maybe helps figure out the solution a little bit better. I think it also depends on the medication. Like you mentioned, I think that it's varying throughout the day. So I do sometimes ask parents to track, are mornings more difficult, are evenings more difficult, because we do have a good understanding of how these medications work. And so pharmacologically, we can sometimes attribute certain behaviors or certain challenges, for example, happening, every evening to like the medication wearing off, or to, the child's being hungry or irritable, whatever it might be. So there are sometimes some like, easy answers to some of these questions, but I think it requires a little bit more, data collection around how the medication is impacting the child, if they're having side effects, or if it's not, let's say it's not lasting as long for them in certain, scenarios. So I think it depends on that. And then likely the more likely answer, or the complex answer, is that maybe there are things that the medicine is not addressing, and that will require therapy and like working with someone to really understand those complexities a little bit better.
Yeah, I agree. The reason why I said it was a good question, I feel like my entire career has been to answer that question in a way, because it cuts to the core. It really cuts to the core of, in my opinion, of what it is we're dealing with and how we think through, it's very complicated how personality interacts with like psychiatric symptoms. Maybe it'd be helpful if I just briefly go over what ADHD is and like what the symptoms actually are. So there's 2 different types, and then there's a combined type, the inattentive type, and then there's the hyperactive impulsive type. So the inattentive type, those are symptoms like trouble focusing, getting distracted, losing things a lot, very scattered, getting sidetracked all the time, kind of spacing out. And then the hyperactive impulsive type would be like physical restlessness, like always jittering, bouncing your leg, getting up, running around, things like that. Kids can't sit down. And then the impulsivity is like cutting people off in conversation, obviously like hitting people, things like that in extreme. So those are the symptoms of ADHD. Personality-based things would be like, for instance, if a child they don't like authority, right? They don't like submitting to authority. So when they're told to do something, they say no. So is that ADHD? Not really. I mean, ADHD would be that maybe they're impulsive about it, right? And so they like impulsively just say no immediately or something like that. But like the actual personality feature of struggling with accepting authority, that would be something that would be separate from ADHD. ADHD usually exacerbates all of that. And as I was talking about before, that developmental story often begins with the symptoms of ADHD and then kind of like develops into these personality things. But that's really why in our practice, we try so hard not to just be medication managers where all we're doing is managing the medications and the symptoms, because there's so much more to people than just psychiatric symptoms. And that's really what we're looking at. So when we see our patients, we're trying to really get a sense of how much of this is the medication, how much of it is the personality. And as Dr. Patel said, therapy is a thing that would change the personality. I will say, though, that medication can secondarily change the personality, because I always say the best medicine is a successful childhood, you know? So if you can control the ADHD symptoms well, and then the kid does really well for like a year, at the end of that year, they're a totally different person. And then that bitterness and that resentment and that difficulty with authority often melts away, the happier that they feel and the more successful they feel.
Great. Yes. Thank you so much for that overview on ADHD. I feel like we have a lot of patients that we see for that particular reason. And, another question we have here regarding that is medication. Somebody is receiving treatment for ADHD and they haven't pursued medication yet, partly because they're not sure when the right time would be to take that step. How can parents know when, that's the right direction to go in?
Yeah, I think that is like a generally very tough decision for most parents to figure out, when is the right time for medications for ADHD. And usually, if someone is already coming to talk to us, then they've sort of already kind of at least decided to get the information around the medications. What I tell parents, in this question, what I would suggest or advise is at least you should do an evaluation to get the information for yourself, right? As parents, I think you should be making informed decisions for your children. And so if you're asking this question, my intuition would say that likely you're feeling like things are becoming more difficult with your child in some way, whether that's socially, academically, personality related, or you have some inclination that they might require treatment. And so I think a good first step would at least getting an evaluation from a child psychiatrist to be able to correctly identify the diagnosis, to give you some guidance around treatment options, and get more personalized answer of whether or not this would be a right time to trial a medication. I think the caution around waiting too long is what Dr. Dean was kind of talking about prior, is that building up of low self-esteem, low confidence, anger in kids, that maybe you wait a little bit too long to address some of the challenges. With ADHD, medications work quite well. I think, don't quote me on the number, but I think the statistics say, I think like up to 70% of kids will respond to at least one or two different stimulants for ADHD. And so those numbers, we really don't have that with a lot of other things in child psychiatry. It's a pretty good response rate, and it speaks to the efficacy of these medications. So I would say likely if you're thinking about it, it's probably a right time. Definitely if it's becoming disruptive to their development or their life in some way, right? So they're getting a lot of negative feedback from friends, from teachers, from you guys around their behaviors. They're becoming more self-aware of their challenges. That's making them feel badly in some way. Then those are definitely like more acute reasons to get treatment sooner rather than later. But I would say, generally speaking, sooner rather than later is the best for ADHD when there is a treatment that exists that is quite efficacious.
Yeah, I agree. There's a reason why we call it the Center for Developmental Psychiatry, right? Because development is the most important thing. So I agree that when I'm thinking about whether or not to start a medication for any condition, but for ADHD, I'm looking really at subjective distress, functioning, and then development. So subjective distress would be like, let's say for anxiety, if someone's like incredibly anxious, it just feels so aversive. That's a good reason just to get some relief to use a medication. Functioning would be like, going to school, doing your homework, things like that, social functioning. But development's really the big one, because as a thought experiment, let's say you have a 50-year-old man who has ADHD, always had ADHD, goes on a stimulant. Wow, all the ADHD symptoms are gone. That's fantastic. But he's not going to be any different in a year or two than, than if he didn't, as a human, as a person. But you take a 5-year-old who needs medication and is bound to go through all those years to the age of 50, and you put them on a medication, and now they go all those years so much more, they will be a totally different person. So I really look for red flags like self-esteem. When self-esteem is taking a hit, that is really, really important to start noticing that. Like a previous question asked about negative feelings about the self and things like that. I'll also just address that, there's a stigma, I think, still, even though we're more open to it as a society. I think there's still a stigma. Like people would say, would you really medicate a child? But we would never say that for like diabetes. Someone has diabetes, like, would you really give insulin to a child? Like, yeah, they have diabetes, or like cancer. Would you really, like, obviously, but when it comes to mental health, I think people feel like, would you really medicate a child? But I say the opposite. I mean, somewhat ironically, would you really not medicate a child? Because, you have so much potential for benefit by really kind of pivoting developmentally at this age. So I really agree with what Dr. Patel was saying. Earlier, better. Early intervention helps a lot because we see people of all ages. We see adults as well, and you can almost always help somebody, but it's a lot harder to unwind years and years and years of difficulty, which gets baked into the personality than to just prevent it in the first place.
Yeah.
Thank you guys so much for answering that. I think that gives us a lot of insight on the importance of early intervention with these cases. Another follow-up question here. We have, how do you help a child who had a negative experience with trying a medication? How do you get them to be willing to try something else or try again?
That's a good question. Something that in our practice, like Dr. Dean was saying, we try our best to actually kind of set up for that, like, around like our conversations with the kid and the child. We have these extensive intakes and extensive amount of time we spend with children and parents to be able to provide that psychoeducation that sometimes the first medication isn't going to be the right fit. That doesn't mean that there is no medication out there that can be the right fit or help you out. But it just helps sometimes, again, set expectations for the child that this might be a little bit of a up and down situation for the first month, but once you figure out what works for you, then it tends to be a lot more smooth sailing. So I think, like, I would say how to help a child navigate like a negative experience is really to talk to a professional who's going to take their time to understand the child's concerns, because at the end of the day, they are taking a medication. It is impacting their body. And I think validating their side effects or however it made them feel is quite important. The way I think about it is, obviously, you have a lot of control over your kid's life until a certain point, right? We want to help set up these children to become successful adults in whatever ways they deem to be successful, right? And one of the, I think, key features of what we think about as successful adults is to be able to access things that are going to be helpful for them: adaptive coping skills, medications, resources that are going to help them. And so if from a young age they're developing these like negative interactions with medications, especially with psychiatric medications, I think that can be quite dangerous as they grow older into adults, because they will be a lot more resistant to medications and treatment that can be quite life-changing for them. So I think, like, really connecting them with someone who will hear them out, will validate their concerns, but will also give them more psychoeducation around why it might have been that they had this negative experience, what we can do to prevent it from happening again, what kind of different interventions may be available so that they don't have that negative interaction again. And if they do have that negative experience, being available, someone who is available to be able to help them navigate it maybe better this time. And so it's not as traumatic or as negative as it was before. But that would be my suggestion, is to really work with someone who will take their time to understand the kids, concerns about it. So that way it sets them up for success for the future. It's more of a long-term game, I think, in this situation, rather than like short-term. You could maybe convince them to do it short-term, but I think working on that long-term mindset is probably the most beneficial for them.
Yeah, I agree that the relationship, is the most important thing. Like when I start an evaluation, this might sound funny, but picking the medication is usually like the easy part, but when I start meeting the parents and I start meeting the child, from the very first moment, I'm like, constantly just trying to understand who this person is and how can I really connect to them, because you could be a brilliant psychiatrist and always get the diagnosis and the medication right, but then the person doesn't take the medication and you did nothing, you know? So I really think the relationship is everything. I agree. And if you have a good rapport and you make that connection, you know, I've been surprised actually to hear sometimes that people weren't even told what the side effects could be, you know? And so I think that's also much more upsetting. If someone didn't realize, it's kind of like surprising, and then you don't even realize what's going on at first. But yeah, I agree that I think that if you have a good relationship with the person who's giving the medication, then hopefully you can try it again. I will say though, at a certain point, you might want to be careful about continuing. You know, like if it's just one time, okay, you could try a second time. But some children are like super resistant to these things, and I think that I really agree with what you're saying, Dr. Patel. That I think you want your children to have positive associations with mental health professionals, because you know, even if they struggle their whole childhood, but when they're 25, they might go see a psychiatrist and then get a lot of benefit. And you don't want them, you want them to think back like, oh yeah, that guy, like Dr. Dean, like he was okay, you know, he wasn't terrible. And so like, if putting them on the fourth medication that's going to give them side effects is going to make them say like, forget it, I'm never taking medicine again, you might have like diminishing returns, and you might actually kind of hold off for a while and maybe try therapy for a while instead. It just depends on the situation.
Yeah.
Great. Well, thank you. Thank you both so much. I wanted to ask some questions regarding general back to school concerns. You know, with it being that time of year, a lot of parents have some anxieties, making sure their child is, you know, going to be set up for success. But can you tell us about some of the most common challenges you see kids facing at the start of the school year?
I think one of the hardest things is returning to a routine. So you know, summer is like fantasy world basically, where like there's no real routine or like real responsibility. And I think a lot of kids really struggle with that, in particular if they have ADHD or a learning disability, because school is just so difficult and they just hate it so much. So that's one of the things that I see. I think it's August 20th, right? So school's starting in like 2 weeks. So um I think this is a good time to start routines again. So have kids wake up early, and they're not, you know, they're not going to want to do this, but have them wake up early in the morning again, as if they're going to school, you know, getting back into like reading, let's say, and different things, and going to bed on time. I think starting the routine again is good. And then preparing, I think, for the homework. I think a lot of parents, it's one of the biggest things is the fight over the homework. So obviously, you know, if there's ADHD or learning disabilities, getting treatment around those things is really important. But I think also finding ways to make the homework thing not such a fight. One of the ways, I really like what you were saying before, Dr. Patel, about having a child take their own initiative. There's something called like natural consequences, right? So natural consequences is, if you don't show up to work, for instance, you get fired, right? So the natural consequence of not going to work is you get fired. The natural consequence of not going to school or not doing your homework is often nothing. You know, it's like nothing happens, because the parents will shield their children from that consequence, and they don't actually let the consequence hit. I think one really helpful strategy for the fighting over the homework is to, depends on the child obviously, but to allow the negative consequence to actually hit. You know, it's like, I'm not gonna fight with you, right? This is your homework. If you want me to help you, you can do it. But like, if you're not gonna do your homework, I'm not gonna do your homework for you. I'm not gonna swoop in and like make sure you do it. You're just gonna get a bad grade. That only works if the child will care, right? And if it's not going to be crushing to them. If it's going to like crush them and they're going to say, okay, I'll never be able to succeed, then it doesn't work. But I've actually seen that be really helpful for a lot of families if those things are in place, because it takes away the power struggle, right? It's not like, I'm not going to force you. I'm not going to like, you know, use my authority and power over you to force you to do it. You're going to do it yourself. And if not, you'll get the negative consequence. I'm not going to punish you. So that's one thing to consider.
Yeah, I agree with that. I guess a little caveat to that is I think that works for a lot of kids. Like you're saying, if you're able to really put the two and two together and have that natural consequence. I sometimes I have like those kids that are just very like not fazed by that natural consequence, or they don't, you know, okay, I failed, like so what? Then I think like I work a lot with parents to figure out like some form of like consequence that can, again, that the kid will care about, right? Like, okay, that's like, and not a punishment, but more of like it's up to you whether or not you want to do your homework. If you do your homework, you can earn this, whatever, 2 hours of video game time. But if you don't do your homework, you're not getting the video game time, and that's okay too. It's totally up to you. So there's no, pressure or anxiety around that decision. That decision is around them, but maybe you're adding on something that is like a little bit more motivating for the child. Again, it depends on the child's personality. I think what Dr. Dean said is likely the best to like enable a more independent child who has like, more like self-responsibility, and like you want your child to be able to think of natural consequences in general as they grow older. But oftentimes maybe with the younger kiddos or the kiddos that you're having a lot of behavioral dysregulation, sometimes just having more structure around that to slowly build them up to that like natural consequence mindset helps, because slowly you're kind of helping them develop those skills of decision making and develop those skills of, choosing something and earning a reward. And then eventually the hope is that the reward is more intrinsic and they can kind of work themselves up to working with you in that setting. But I think like really thinking about that with your family system and like your kid's personality and see what would work. But thinking about it now, when stress is low, when there isn't a pile of homework, when conflict has been low, makes the most sense, because that will be the most, I think, fruitful for everyone. It will feel the least negative for everyone. And then hopefully it creates at least a conversation to keep building on it as school starts.
Right. Yeah, I think I agree. It depends. Everything depends, kind of, which is always like not satisfying when we just say it depends, but it does depend on the situation. I thought maybe I'd just touch also on school refusal, or school avoidance, which is a really big topic that comes up a lot. And first to say that, not to be so dramatic, but a lot of people don't realize how serious it can be. I've had patients where get the flu, they don't go to school for 3 days, and then they don't go to school for 2 years, that kind of a thing. And because what ends up happening is the longer a child is out of school, the more anxious they get about going back, because what are you going to tell people when they ask you? And there's going to be a pile of work they have to fix. So then if the first day they were too anxious to go, the second day they're like even more anxious. By the 5th day, by the 7th day, the 10th day, it's like impossible. And I've had patients where it's very insidious. They don't even realize, the family doesn't realize. And parents sometimes don't know what to do about it, because it's like your child is, let's say, like throwing up from anxiety in the morning. You're like, okay, I'll just keep them home. And parents might be wondering whether that's the right thing, the wrong thing. So in general, I guess, everything depends, as I was just saying. But for the most part, you want to really push them back into school as much as possible, with the caveat that I guess if they're going to have like a full-blown panic attack or something like that, then maybe not. But in general, you really want to push pretty hard, because of what I was saying, that the longer it goes, the worse it gets. And so to the point where sometimes we even use medication just to take the edge off the anxiety, to get the child back in. Sometimes it can be helpful to do it in like a graduated way. So in other words, if going back for a full day is too much, you can work with the school. Like, can your child go in for like an hour and then go home, let's say, or even when school's not in session, go back into the school building and just kind of like walk around and just kind of get comfortable again with the situation. But as the school year is about to start, I would just kind of like, I guess, mention that as like something to be cautious about, that if you see that your child is not going, to not let that go too far, and to get help right away, basically, if you see that happening, because I've seen it get really out of hand.
Yeah, I would definitely second that as well. I think we've seen like pretty severe cases of school avoidance, or even, sometimes we have adults who like just ended up never going back to school after COVID, for example, and just sort of, ended up getting their schooling done online. And it just hinders like the developmental trajectory for a lot of these kids in a very severe way. So I feel like Dr. Dean said, I feel pretty strongly about recommending, as always, like as strongly as possible, to go back to school, even if it's for an hour, even if it's just in the resource room or it's just for lunch, to really just be in that setting for whatever time they can tolerate. And so the conversation with school avoidance is always, okay, if you have a panic attack, this is like something you can do. You can go to your counselor, you can get these resources, so you're not, forcing them to stay in like acute distress the entire time. But the avoidance of just not going to school is just not acceptable. Like, you do have to go to school, but there are other things maybe we can work towards to like help reduce the distress. Obviously, medications is like another tool we use, but oftentimes we work a lot with schools to kind of like work on that flexibility, give kids breaks, give kids access to counselors and things like that, that maybe like reduce the anxiety for them a little bit, and then address like whatever the issue might be, right? Like if this child is avoiding school because they're really, really struggling academically, and they have like this learning disability that was never caught, and now, you know, now it's just like led to school avoidance, sometimes fixing that and like getting an evaluation and addressing the disability, giving them accommodations or medications, oftentimes that also feels enabling for the child, where, okay, something's different now, so maybe the outcome will be different as well. So yeah, we work a lot closely with schools and parents to really make sure that it doesn't progress to this like severe avoidance where then it's really, really difficult to get the kiddo back in the school system.
Great. Thanks so much for touching up on that. That was actually one of our questions. So great segue into, you know, the resilience aspect of it. I guess we could talk, since you are mentioning schools and school support, is there anything parents could know about IEPs or 504s or any other kind of school-based supports if their child is struggling academically or emotionally?
Yeah, that's a good, I guess that's another aspect also of school avoidance, right? Where sometimes kids just don't have the resources that they should have. Like, let's say you have a kid with autism, they should likely have some extra support and services or smaller classrooms and things that an individualized education plan like an IEP can provide. So sometimes it's a lot of like, you know, working with the schools and the parents to be able to get them access to these resources. Typically in New Jersey, school districts usually just start with a 504 plan, right? So that's a plan where you talk to a psychiatrist or a psychologist, and they might, you know, diagnose your child, for example, with emotional problems or with attention issues, and they might say that a child requires a 504 plan. Essentially, what a 504 plan is things that a school can easily implement, like extra time on tasks, or, you know, double time for quizzes, you know, being able to take a break if they need to, like things that don't actually require additional funding, they can do with a 504 plan. So in my experience, it's quite easy to implement a 504 plan with most school districts. You just get a letter from one of us kind of, you know, confirming the diagnosis and the needed accommodations, and they're able to do that quite quickly. An IEP process is a little bit more involved because it does require federal funding, and it is something that requires a school to do testing and psychoeducational testing, educational testing around the child's needs. So for that, you know, usually sometimes the conversation is, let's try the 504. Does that help the child be more successful in the areas that we want it to be? Or no, this child is someone that has higher needs, that has autism or that has, you know, severe ADHD, and they are going to need an IEP. What a lot of parents don't know is that to start the process, they should write a letter to the school. So it has to be a written letter coming from the parents requesting an IEP evaluation. And that gives the school 90 days by law to address that concern. They might come back and say, here, this is how we're going to start off the process. Let's start with a 504. But essentially they have to start the conversation and address the parents' concerns. So I think like knowing that is a good, helpful tip to be able to get the ball rolling, because it does sometimes takes a while to get the IEP evaluation completed. Benefits of an IEP sometimes that, you know, later parents find out is sometimes, depending on the child, if this is a child where they might need more specialized schooling, they might need alternative, you know, resources, or maybe this like public school that they're going to is not able to address their needs, they will need an IEP to be able to show that all of these interventions have been done, to consider alternate placement, for example, or to consider higher levels of treatment. Even children who end up needing residential treatment, oftentimes they require an IEP to be in place. So sometimes it is a barrier for certain cases. And so it's something to kind of be aware of and think about proactively, like if you have a child with higher needs or they're just not successful with a 504 accommodation plan.
Yeah, that was very well said. I wanted to add, someone asked me recently about accommodations in private schools. So I thought maybe, I don't know if this person is watching, but hopefully, but I guess I'll address it now. It's a little bit tricky with private schools because the same kind of plans can be done, but the problem is that private schools often don't have the resources, and they're often not equipped to really kind of provide some of the services that a public school would. And so in my experience, it's a little bit of like a balance, because you want to get some services for your child, but if you ask for too much, then they'll be like, oh, whoa, like this is too much for us. Like this is not the right fit. And you know, you could actually sometimes have a school say that they can't handle your child. And so, strictly speaking, if someone has really like a lot of needs, a public school is often a better fit. If you go the private school route, then you know, you could talk to us, like obviously on the specific case about how much you want to tell the school, how much you don't want to tell the school. They can usually do like a 504 plan pretty easily, because that's like, I agree with Dr. I think of that as like the free part of things. It's like, it doesn't cost anything to give you extra time. But if you're going to need like, you know, extra reading tutoring and things like this, and social skills training and stuff, you know, or like an aid, like a shadow or things like this, that might be a little bit out of the scope of, you know, because the idea behind all this, you know, it's federally mandated, these laws, that every child should get an equal education despite any disability, and mental health things fall under that umbrella. But for a private school, they could just say like, no one ever said you needed to come to this school. You know, you could go, you know, the public schools, obviously that's the public education. So it's a little bit tricky. I'll also add, you know, you can get extra time on the SAT or ACT if you have ADHD and you need that. But like, you know, Dr. Patel, you were saying you need an IEP to get some of these placements. I believe you do need to have those accommodations in place in high school before you take the tests. I don't know if you need an IEP, but I don't think you need an IEP, but you need to have you need to have documentation that you've already had these accommodations. So for people who are thinking about taking those tests, it's again, if you actually need the accommodations. I know this is like it's kind of like a hot topic now about getting accommodations for the SAT. But if you need the accommodations, getting them in place beforehand is usually important.
Yeah, definitely.
Yeah, and a follow-up question to the 504s. Somebody had said not every teacher sticks to it consistently. It really seems to come down to each teacher's style and personality. Do you have any advice for making school feel less negative for your child with ADHD?
I mean, they have to follow it. I know they don't always, but you know, I guess if they're not following it, then you have to choose how you want to deal with that. So I think my approach that I usually recommend is to try to work with them in a pretty collaborative, nice way, because you know, you could take the approach of, let's say, being very strict with them, or even threatening to like involve a lawyer or something like that if your child is not getting what they're supposed to get. But I find that when you do that, it creates this like adversarial relationship. And then, you know, I often say you have to remember, like, these are the people that your child's being left with all day. And so if they hate you, you know, then by extension, they hate your child. That's not going to go well. You know, we're talking about like that negative feeling a child's going to get. So I think what I would recommend is just trying to open up a lot of communication with the teacher. Teachers are like anybody else. Like, some of them are really psychologically minded, some of them are not. So some of them might just decide, oh, the 504, like they don't really need it, but that's not really up to them. So I would just try to have really open communication with the teacher, and then, you know, with the child study team. And then maybe they could kind of like work with the teacher a little bit to educate them a little bit around these things. But the 504 plan really is supposed to be implemented. So if you find that it's not, that's what I would say. But I think trying to make that relationship and try to have a really positive relationship, that's like in general in life. If you actually have communication and relationship with somebody, even before there's a problem and then a problem arises, it's so much easier to deal with it than if like you've never spoken to the teacher and then all of a sudden you're showing up with like, you know, guns blazing, so to speak, and saying you need to do this. The person's going to naturally be very defensive and not want to cooperate with you.
Yeah, I agree with that. But you know, I do think this is like a valid concern that you're seeing around feeling that like child feeling less negative about school, because I think that like kind of points to all of the conversations we've been having today for the last hours around their like, you know, relationship to school, their confidence around academics, which for a child, you know, that is their job, right? Like going to school is their job, and that does have a huge impact on like how successful they might be in other areas of life as well. And so I think it's like a two-part conversation. Like I agree with Dr. Dean, and like, you know, having a close relationship with the teachers and the school that they're going to is really important, because they are spending a lot of time in those settings. And it's important that everyone who is interacting with your child has a good understanding, a thorough understanding of their needs, and is receptive to feedback around how they should be implementing some of these accommodations. And then I think the second part that I would recommend is for the child to really also work in their own therapy around understanding that, you know, the world is not ideal, right? Ideally, we want all the teachers to respond well to our requests and to the accommodations and stuff, but, you know, obviously they will encounter people who are not understanding of their diagnoses or their challenges, or not understanding of their requirements. And then what do you do, right? Like, there's two options. You can, you know, either like kind of feel really badly about it and impacts your mood and your self-esteem, or you navigate it in a way that maybe enables you to use your communication and advocate for yourself, and you know, really like learn ways to deal with it, and also accept that maybe some things are out of your control, and you just try to put yourself in as much positive interactions with people as much as possible. So I would say that's a part maybe that you have more control over, is that like how much your child is able to work in therapy, of like understanding that, you know, this is something that is unfair, likely, however, it will happen, and this is not the first time that's going to happen to them, and like in this safe setting is a good way to deal with it and figure out ways to cope, and like figure out how to think about it in a less negative way that impacts their like mood a lot less, and like impacts their like thought process around the school in like a less negative way. So I would say like that's important. It's for them to be able to talk about like these experiences, and like, you know, with a person who can like help guide them in a more positive thinking about it, or a more productive way of dealing with it, than just kind of spiraling into this negative, you know, I hate school, school hates me, and that's just how it's going to be.
I think that, oh, sorry.
No, didn't.
No,
That's
I think that's such a good point, because I think one of the most important things that we want our children to develop is a sense of resilience. And it's such a tough balance, because even if you think about these accommodations, life doesn't always accommodate you, right? So when you give a child accommodations, I think there should always be a conversation, even from the beginning. How are we going to get you to not need these accommodations potentially, right? Or I think what you're pointing out is just such a good point, which is the world is not going to always accommodate you. And so we're going to accommodate you. We want you to have all the resources and all the help in the world that you need. At the same time, how can you try to get by if you don't have that? You know what I'm saying? And I think that's such a tough balance, because you don't want them to feel unsupported. You don't want them to feel bad. But I think if you do it the right way, I agree with what you're saying very much, that you can empower the child to feel like, okay, I have this thing. Everybody has something. You know, this is the thing that I have. I have to learn how to manage this. I have to learn how to get by, and not to always look at everybody to like remove the problem. And, you know, like, again, it's tricky, because they deserve, you know, legally they have to get the thing, and legal, and they should be getting it, but also the reality that like maybe they're not going to get it sometimes. I think that's such a good point.
Yeah. And I think like, you know, really helping the kid focus on the times they are getting it, right? Like if there are classes where the accommodations are happening and they are successful, then really kind of helping, focusing and reflecting on that positive reinforcement around their positive behaviors that they might be having in some classes. And then let's say they're struggling in like another class where the teacher maybe isn't as receptive to the accommodations, then at least they can do it in like a safe therapeutic way of figuring out like, all right, like there are some things that will be more difficult for me, and it sounds like this class is like a little bit more difficult because of all of these different factors, but it's not just me. So I think like it kind of like disperses some of that stress of feeling like a bad kid, or feeling like I'm the problem, when, you know, there are some challenges I have, but there's also a lot of challenges around me in this environment, this teacher, this, you know, school, and that's also contributing to my difficulty. And again, that will help protect the self-esteem a little bit more if they're able to work with someone to identify all the environmental kind of contributions to how they're succeeding, and really focusing on some of the positive interactions they might be having at school as well. So they're not just like stuck in this negative interaction mindset.
wonderful. Well, thank you, Dr. Dean, Dr. Patel. If there's, I know we're coming close to, the end of this webinar here, but if there's, any last minute topics you guys wanted to touch on, I think you covered such a great aspect, very wide range in our topic. I love these. They're so open-ended. We can really go anywhere here. So yeah, any closing statements?
Well, thank you for joining us. I think what I would say is it's often a very stressful time for a lot of families, and whether you're an existing patient or someone else just kind of watching, we're here to support you through this time with any way that we can. If you are wondering if your child might have ADHD or whether it's time to do medication, some of these questions and things like that, and you think that we could help with an evaluation, we'd be happy to do that and help you. Otherwise, you could always just kind of, send in questions to us over email or things like that, and we can try to get back to you that way.
Okay, well, thank you so much, Dr. Dean, Dr. Patel, for sharing your insights today. And thank you to everyone for joining us. We hope that this information was helpful for you in getting ready for the beginning of the school year. And of course, if you'd like to connect with us, like Dr. Dean said, we're here to help. You could reach us at 201-304-7552 or check out our website, developmentalpsychiatry.com, to learn more about our services and resources. I will also be sending out the recording from today. So if you feel like anybody would benefit from listening or viewing it, please feel free to share it. And on behalf of our team, we do wish you and your family a smooth, healthy, and successful school year. So thanks again for being here with us today.